Hi, my name's Chris, and I'm with the British Columbia Lung Association, and I have the pleasure of sitting here with Dr. Doug Dockery, who is the Loeb Professor of Environmental Epidemiology at Harvard. Welcome.
Thanks, Chris. Nice to be here.
Let's get right into it here. What is the best scientific evidence that health improves when air pollution decreases?
So we've had a couple of examples where air pollution has improved dramatically under special situations, like in Utah Valley, when the steel mill workers went on strike and the air quality, the steel mill closed down for a year, and we saw major improvements in air pollution and also major improvements in terms of reduced asthma admissions for children in that situation. But more generally, I think the best evidence is that over the past 20 or 30 years, we've seen major improvements in air pollution, air quality in the United States, and we've been able to associate that with improved life expectancy in populations all across the United States.
So what health outcomes improve the most when that air quality is reduced? And you just mentioned populations. So what populations experience the most benefit?
Well, we know that most of the people who are most effective are certainly those with pre-existing conditions, chronic obstructive pulmonary disease or congestive heart failure or coronary artery disease and so forth, who have limited reserve capacity and really can be affected. So those are the ones who see the benefits most immediately when those have been improvements. But in the long term, I mean, that air pollution contributes to the development of those conditions means that there are also changes in that underlying susceptible population.
Yeah, that's really good. So what are some examples of effective air quality management policies or interventions, and what's made them so effective for you guys?
There have been, it's really been national policies that I think have been most effective in terms of putting controls on automobiles, automobile emissions, reducing, we have almost a 95% reduction in emissions from automobiles over the past 30 or 40 years. And also restrictions in power plants, specifically reducing sulfur coming out of stacks, power plant stacks, which leads to not only reduced sulfur oxides in the air, but also reduced particle levels. And those have had very dramatic effects, especially in the Northeast where I come from. We can see the effects of the power plants in the Midwest and the central part of the United States being transported into the Northeast.
Well, I mean, that's amazing. It sounds like there's some tremendous successes that are happening both in the States and right here in Canada. So why should we continue to pay attention to air quality if it's getting better?
Well, I think what's been interesting is that we have not been able to show that there is a safe level of air pollution, that even in what we consider clean communities, when we've been able to reduce air pollution levels, we've been able to see improvements in health in terms of reduced life or increased life expectancy or reduced hospital admissions and so forth. I mean, there really doesn't seem to be an optimal or safe level, and whatever we can do to keep pushing down the air quality levels are going to lead to improved health.
And now, if those policies right now aren't demonstrating that definitive improved health, does that mean that it wasn't worth implementing at all?
Well, I disagree with you. I think we've been showing that actually, as we've been able to look at cleaner and cleaner areas in North America, for example, we can still see those health effects. Here in British Columbia, for example, there's very strong evidence that even with the clean air here, you can see benefits to reducing air quality or improving air quality in terms of health. So there are benefits, and in fact, it appears that the greatest benefits come when we're getting down into those regions where the air quality is what we would consider clean by the old standards.
So it's great that we're seeing successes, and we're going to continue to dive deeper into that. That's all the time that we have for today, so I really want to take this opportunity to thank Dr. Dockery for being here all the way from Boston and Harvard. Thank you very much.
Thanks, Chris.